This is an introduction to WASH in healthcare facilities presented by the Center for Global Safe WASH at Emory University. It's intended as background information to help anyone looking to start work on WASH in healthcare facilities, whether you're working specifically at the facility level or somewhere else in the system, nationally or perhaps globally. This builds upon a presentation we put together in 2018, but with updated data, resources, and approaches that have taken place in the last 4 years. So the objectives of this presentation are to define WASH in healthcare facilities, to determine the status, to review evidence, health linkages, and cross-cutting themes within WASH in healthcare facilities, and lastly, to discuss action and resources. So first, what is WASH in healthcare facilities, to make sure we all start on the same page? We define WASH in healthcare facilities as the WASH infrastructure, resources, services, and practices in a healthcare setting. And to note, in a healthcare setting, we refer to this as anything from a health post where outpatient services may be provided or dispensary, all the way up to tertiary care, high-level hospital offerings such as surgical services, deliveries, etc. Within WASH in healthcare facilities, we break it down further into 5 key components: water, sanitation, hand hygiene, waste management, and environmental cleaning. So by water, we're referring to water access, distribution, treatment, storage. Sanitation looks at certainly toilets and latrines that are available for both staff and patients, as well as perhaps issues such as fecal sludge management within the healthcare facility. Hand hygiene, of course, thinking about the ability for doctors, nurses to be able to wash their hands, but certainly beyond that, thinking about others in the facility who may need to be focused on hand hygiene, including patients, caregivers, cleaners, etc. Waste management is the correct management and disposal of waste that's created by the healthcare facilities. So thinking about the infectious waste, sharps waste, non-infectious waste in particular. And lastly, environmental cleaning, looking at the cleanliness of both patient rooms where patients' care takes place, as well as the wider facility, so facility grounds or toilets, other places that may require cleaning services. So which healthcare facility activities require WASH or some element of water, sanitation, and hygiene? The most obvious that comes to mind is probably hand hygiene, but it's actually more complicated than that. Other facility activities that require WASH may include medical and surgical procedures, such as for cleaning wounds or irrigating tissue, patient hygiene and bathing, drinking water, including oral medications, the use in certain medical devices, such as CPAP machines, which require a certain quality of water, sanitation, environmental hygiene, cleaning, disinfecting, and sterilizing of medical equipment, laundry, healthcare waste management, laboratory activities, and the production of hygiene materials. And certainly the type of activities that may take place in the healthcare facility likely are determined by the size of the facility and the kind of services that healthcare facility provides. So this list may not be comprehensive of every facility, but gives you an idea of the kinds of things that will take place. What is the current situation? So let's look at the data that's available at the moment on WASH in healthcare facilities. In 2015, WHO and UNICEF published a report on WASH in healthcare facilities. This was the first such global report that gave an idea of what the conditions were in healthcare facilities in low and middle income countries, including data from about 65,000 healthcare facilities in 54 countries. And it should be noted, it drew upon existing healthcare facility data. So not all indicators that were pulled together were necessarily specific to the WASH sector or had been reviewed by the WASH sector. So it allowed for only limited analysis, but it did start to point us in the direction of the major gaps we had in WASH in healthcare facilities. For example, recognizing that there is limitations in access to improved water sources. Following the release of this report, there was a discussion to update the core indicators for WASH and healthcare facilities through the Joint Monitoring Program for Water Supply, Sanitation, and Hygiene, or JMP, which is run by WHO and UNICEF, so that we had a common set of indicators we could use across a variety of surveys and monitoring tools to understand how we were progressing towards a global goal of 100% coverage by 2030 to be in line with the SDGs. So it reviewed the existing indicators and updated them, identifying 5 key categories of WASH and healthcare facilities. As I mentioned before, these are water, sanitation, hand hygiene, healthcare waste management, and environmental cleaning. And in addition to actually developing specific indicators, there was also a ladder that was developed to measure progress through 3 service levels, starting with no service, moving to limited service, and then coming to basic service levels, where it's really the minimum requirements for a healthcare facility for WASH services. Here's the ladder that, this is the basic service indicator for the JMP ladder. Again, broken into the 5 categories. So water is available from an improved source on facility premises. And so, for example, the biggest change that took place here from the 2015 data that was used was that they had said water is available from an improved source within 500 meters. That indicator had actually come from household surveys, but upon discussion with health colleagues and others in the WASH sector, it was clear that 500 meters was not really reasonable for a healthcare facility to have to travel to gather water. And thus, this is the updated indicator. Similarly, indicator developed for sanitation. Improved sanitation facilities are usable with at least 1 toilet dedicated to staff, at least 1 sex-separated toilet with menstrual hygiene facilities, and at least 1 toilet accessible for people with limited mobility. For hand hygiene, you have functional hand hygiene facilities available at points of care and within 5 meters of toilets. Waste management, healthcare waste is safely segregated into at least 3 bins, and sharps and infectious waste are treated and disposed of safely. And lastly, environmental cleaning. Basic protocols for cleaning are available, and staff with cleaning responsibilities have all received training. Each of these has further definitions for the specific terms used in it, for example, points of care. And so if you look at that core indicators document, it gives you all the specific information you need to actually collect this information. And each of these is broken down into specific questions to be asked on surveys. So here's the ladder, the JMP ladder. So we talked about there is the no service level, limited service, and basic service. And basic service being considered really the minimum requirements for a healthcare facility. Advanced service can be defined at the national level, and in some countries are moving forward to do so, and maybe taking additional considerations into place. So for example, wanting to have water piped into the healthcare facility could be at an advanced service level. Following the publication of the JMP indicators, the JMP pulled together data for a 2019 baseline report and a 2020 progress report. And actually at the time of this recording in March 2022, there'll be another updated report in June or July of this year with data for the 2022 report. The progress report from 2020 includes almost 800,000 healthcare facilities, up from the 65,000 in 2015. And there's 165 countries that have participated versus just over 50 in the first scoping report from 2015. The data has been collected between 2000 and 2019. And keeping in mind that some of the indicators that were put forth by the JMP in 2018 are brand new, there's not data available for each of them. So some countries report on all of the indicators, some countries report on some of the indicators, making it difficult to create regional and global estimates. But if you look in the 2020 report, they'll have a snapshot of a number of different data estimates for different regions and for each of the categories. So here's a summary of the basic service levels, looking both globally, and then they also did a breakdown by least developed country, looking at the 46 least developed countries. So for example, for water, 75% of facilities globally have access to basic water services. In least developed countries, it's 50%. For sanitation, hygiene, and waste management, there is insufficient data for a global estimate. Again, this is likely because of the fact that these are newer indicators that were put together, and at least part of the question is not something that was available on a previous assessment form. So hand hygiene, for example, there is a part of the hand hygiene indicator that talks about hand hygiene at toilets, and that has not been asked in previous health facility assessment tools. So what they've done is there's another way of looking at it, and it's using a different data. So it's not quite apples to apples, but you can see an idea of the way in which the status globally to date. So for sanitation, we know that 90% of facilities globally have improved toilets, but that's only one of the five pieces of information that are needed to fulfill the sanitation indicator, along with things like menstrual hygiene management and disability accessible toilets. For least developed countries, there actually is enough data to make an estimate. 37% of countries meet basic services. For hand hygiene, the only data available, as I mentioned, is hand hygiene at points of care. So 68% globally, interestingly, 74% in least developed countries. Waste management, we know that 69% of facilities have systems for waste segregation globally, but actually in least developed countries is enough to say that only 30% of facilities meet basic services. And then environmental cleaning, those indicators were brand new across the board, and there's insufficient data either globally or in least developed countries. It's worth keeping in mind that the Joint Monitoring Program provides global monitoring of wash and healthcare facilities, and by necessity can't go deep into any given facility or even given country in terms of the issues and gaps that they may be facing. Thus, there may be other considerations you want to look at when doing an assessment or trying to understand the concerns of wash and healthcare facilities. So what else matters? There may be issues with functionality of wash services, or continual availability or seasonal availability of things like water within the healthcare facility. There may be concerns about quantity of water, of toilets, of hand washing stations, or concerns about water quality. There may be issues with hygienic conditions, climate resiliency, or concerns about user-centered design, inclusive design, and wash-related behaviors. So to think more about this, you can look at the JMP indicators specifically for delivery rooms, as well as Annex A of the core questions for wash and healthcare facilities for additional monitoring topics. We also know that the wash fit assessment may be another place to pull questions for this issue. So now that we better understand the gaps in wash and healthcare facilities, the question becomes, what will it cost to address them? WHO and UNICEF developed a costing estimation study where they looked at the 46 least developed countries. Published in April 2022 in the Lancet Global Health, they estimate it will cost between $6.5 and $9.6 billion to meet basic wash services in all healthcare facilities in the least developed countries. This includes capital investment and ongoing operations and maintenance between 2021 and 2030. This is equivalent to less than $1 per capita per year. This study was the first of its kind, and it found that it's actually far less expensive than originally billed to address wash and healthcare facilities. Thus, as we discuss in the next section, the benefits of wash and healthcare facilities far outweigh the costs, and therefore it must be considered a non-negotiable when discussing high-quality healthcare. So next theme we want to talk about is, why is wash and healthcare facilities important? Why do we care? Why are we pushing this forward and trying to make sure that all healthcare facilities have access? Wash and healthcare facilities is a no regrets investment and should be considered a non-negotiable for all healthcare facilities everywhere. And I really appreciate this infographic from WHO and UNICEF calling wash and healthcare facilities a best buy, producing 50% return on investment. And in particular, here are the key arguments they use to support wash and healthcare facilities: issues like improving quality care, slowing the spread of antimicrobial resistance and preventing the spread of hospital-acquired infections, preventing the spread of outbreaks like COVID-19, cholera, and other deadly infectious diseases, improving the safety of deliveries and reducing preventable maternal and newborn deaths, and saving money. So let's delve a bit deeper into how wash and healthcare facilities fits within the health sector agenda and strategies and links to health sector initiatives. First and foremost, we look at quality care, because WASH is essential to providing quality healthcare services and avoiding preventable deaths. This is linked to other health initiatives such as primary health care or universal health coverage, health system strengthening, and maternal, newborn, and child health. Within the most recent Global Progress Report from 2020, WHO and UNICEF actually developed a figure that takes you through the lens of the 7 elements of quality as it relates to WASH and IPC, helpful to emphasize how WASH is related to effective, safe, people-centered, timely, equitable, integrated, and efficient care. Really important when we think about arguments as to why WASH is a non-negotiable in providing quality health services. Next is infection prevention and control. And IPC protocols require WASH services and commodities in order to provide safe, quality healthcare. So again, linking back to quality health services. Through this Venn diagram, you can see that there are elements of WASH and IPC that overlap, specifically hand hygiene, environmental cleaning and laundry, medical equipment processing, and healthcare waste management as the 4 that we tend to emphasize, though there may be other activities or other ways of organizing this based on the activities and based on the healthcare services provided at the facility. Thirdly, we look at thwarting threats. WASH is critical to ensuring healthcare facilities are resilient. And we look at resiliency based on outbreak preparedness. So issues such as COVID-19, certainly we've seen, cholera outbreaks, Ebola, or disease X, whatever the next pandemic or epidemic may be. Antimicrobial resistance is certainly a concern as those infections continue to spread in healthcare facilities, making sure that there are IPC protocols in place to ensure there isn't further mutation and spreading of antimicrobial resistance. And lastly, climate-related disasters. We want to touch on the COVID guidance here. When WHO and UNICEF put out their recommendations around COVID guidance for WASH and IPC, it emphasized frequent and proper hand hygiene, managing excretia safely, maintaining regular cleaning and disinfection practices, and safely managing healthcare waste. And these documents can be found on the WHO website in specific to how WASH and healthcare facilities should be handled in these scenarios. Certainly then also to spotlight climate resilience, there are 2 ways in which we think about climate resilience for WASH and healthcare facilities. The first is that health systems and WASH infrastructure are designed to be climate resilient or risk informed. And that's really going to be the emphasis of any assessments or interventions that take place. But certainly, secondarily, we want to make sure that health systems are built and operated to lower carbon emissions and foster environmental sustainability. So you may hear the phrase green and climate resilient healthcare facilities, and that's what this is referring to. So as we think about why it's so important, we develop health facility programs in such a way, emphasizing WASH as an element of ensuring climate resilience. And lastly, I want to emphasize the importance of gender responsive WASH in healthcare facilities. Poor WASH services in healthcare facilities disproportionately affect women and girls. 70% of the health workforce globally is female, yet leadership positions are still predominantly held by men. And so thinking about where women get to have a say in terms of the services that are provided and making sure that we're being inclusive and thinking about what WASH services are available to meet the needs of women and girls. And of course, patients, meanwhile, female patients have unique needs which require specific WASH considerations, not the least of which is that women come to healthcare facilities to deliver their babies, but additional needs they may have, including menstrual hygiene management, postpartum bleeding, and other concerns. So lastly, now we think about what WASH in healthcare facilities is, the current situation where we see major gaps in terms of access to basic WASH services globally, and the key linkages to WASH and other health initiatives and health actions underway by the global health sector. What are the actions needed to move WASH and healthcare facilities ahead, and what is currently happening? In 2018, UN Secretary General Antonio Guterres used the Water Action Decade to make a call to action for WASH and healthcare facilities, really emphasizing the need for us to work together to improve water, sanitation, and hygiene in healthcare facilities globally. And together we pulled together a vision and a global goal that every healthcare facility has the necessary, functional, and climate resilient WASH services and practices in order to provide essential quality health services for everyone everywhere. And I hope you understand that there's those key buzzwords popping back up here: climate resilient, quality health services, everyone, everywhere. It's really the goal and the vision that we're moving towards here. In addition, WHO and UNICEF have developed targets. So by 2025, 80% of healthcare facilities should have basic wash services. By 2030, reaching the goal of the Sustainable Development Goals, 100% of facilities should have basic wash services. We also look at equity. So WHO and UNICEF want to ensure that we develop improvements that seek to address inequities across geographic areas and among the different service levels at facilities. And lastly, they put together metrics for success, including ensuring that countries undertook situation analyses, developed standards, developed budgets, and worked to integrate WASH into health sector planning. Then in 2019, at the World Health Assembly, there was a resolution put forth on WASH in healthcare facility that was passed by all 194 WHO member states. And it outlined the actions that are needed to meet universal coverage by 2030. And those actions actually have really been outlined in what we call the 8 practical steps. And this is just a basic roadmap for countries to follow in order to achieve the universal coverage by 2030, starting with situation analyses and assessment, moving on to setting targets and defining roadmaps, establishing national standards and accountability mechanisms, improving infrastructure and developing operation and maintenance plans, developing monitoring indicators and reviewing that data, supporting the development of health workforce, engaging communities, and conducting operational research and shared learning. Should be noted that though they're listed as steps, certainly some of these things will happen in different orders or simultaneously. Some of these may take place nationally, while others are taking place subnationally. All of it with the goal of supporting the government to reach 100% coverage, but certainly leaning upon other partners to take up some of the mantle to help move this issue forward and across the finish line. WHO and UNICEF have put together a country tracker for WASH in healthcare facilities that you can find on their website, washinhcf.org, and it tracks those 8 practical steps. So you can see with the different colors, red, yellow, orange, and green, to denote the status at which all these countries are in terms of their progress towards the 8 practical steps. I believe there's about 50 countries currently listed, and certainly looking to continue to track more in the year to come. There are also global bodies that are working together with unique roles to further WASH and healthcare facility progress. There's a UN group of friends, which you may hear about. It is the UN permanent representatives working together to elevate and advocate for this issue. Not something that global practitioners at the country level will likely be involved in, but certainly something to be aware of. There's also a global task force that's helping to set the agenda and priorities for global WASH and healthcare facilities action. And lastly, there's a community of practice that's open to all to share learnings and talk about specific issues within WASH and healthcare facilities. It's currently run by Emory University. And so the Community of Practice Initiative is, as I mentioned, action-oriented learning platform seeking to connect practitioners. We look to connect, share, and act, and delve into issues such as gender-responsive WASH and healthcare facilities, the dialogue between WASH and IPC, and really hope to foster conversation between all of the members of the community in order to move this issue forward and ensure 100% coverage by 2030 and beyond. As mentioned before, there are a number of resources available. The most prominent that you may have heard of already is the WASH Fit tool, or the Water and Sanitation for Health Facility Improvement tool that WHO and UNICEF put together to offer a risk-based approach to improving WASH services in healthcare facilities, and working with both the WASH actors and the health actors together to integrate this into healthcare facility planning. A new version of WASH Fit 2.0 is available in April 2022. And you can find it and more resources, case studies, and updates if you go to washinhcf.org and look in the resources tab. So just in summary, to talk about global action and think about where we've been and where we're going. In 2015, there was a status report published that really started to raise the alarm about the situation, recognizing that there were major gaps that we as a global community and practitioners should start to take action on. In 2018, there was a call to action from the UN Secretary General, really spurring the UN agencies into action and helping to give support for advocacy at the national level to move this issue forward, leading to the World Health Assembly resolution in 2019. In 2021 and 2023, there are required reportings back to the World Health Assembly on progress to date. So the last one took place at the last World Health Assembly. The next one will be a year from now. And then in 2030, there is the end goal of universal coverage of WASH and healthcare facilities, meeting SDG 6 and 3, among other SDGs. But what are the next steps for national action? Based on the most recent progress report, WHO and UNICEF outlined recommendations that are really valuable when thinking about where we are to date and where we need to go. So they recommended implementing national targeted plans with a dedicated budget. I think the dedicated budget part here is most key, as it was shown that very few countries had dedicated budgets at the time of initial assessment back in 2015. Monitor and review progress in improving services, practices, and the whole full healthcare environment. Develop the capacity of health workforce to promote and practice good hygiene and improve the quality of services. And lastly, integrate WASH into regular health sector planning, budgeting, and programming. So no matter where you are working within the WASH and healthcare facility space, if you're sitting at a facility itself and thinking about how you improve through a WASH Fit tool, you're sitting subnationally and considering how you might provide technical support, develop workforce capacity, or create budget line items, or if you're sitting nationally and want to develop policies and advocate for integration of WASH and health, there is action for all of us to take in order to move this forward. And just a quote from Dr. Maria Neira, which I really think sums it up: a healthcare facility without WASH is not a healthcare facility. Really, this needs to be considered a basic requirement of every healthcare facility in order to provide safe, quality healthcare. So some key takeaways from this presentation. First, billions of people visit healthcare facilities that have inadequate WASH services, particularly in least developed countries. We know that impacts their ability to receive safe, quality healthcare, and also to ensure that we protect the healthcare workers that are serving those facilities. WASH is a fundamental prerequisite of quality of care, and there cannot be an effective IPC without WASH. WASH in healthcare facilities is a solvable issue and should be considered a non-negotiable in all healthcare facilities everywhere. And lastly, collective action is needed to address the deficit, and resources are available to support scale up and sustainability. And certainly a great place to start to learn about other key actions, country examples, and other case studies is washinhcf.org. So for more information on WASH and healthcare facilities, we encourage you to join the community practice that Emory runs. Go to washinhcf.org/COP, and we look forward to having further communication and conversations that take this beyond an introduction into really delving deep into how to improve WASH and healthcare facilities. Thanks so much.